National Pink Day for Summer Breast Cancer Awareness is just around the corner, coming up this next Saturday, June 23rd. And we've been talking about it throughout the month. We took a look at some of the statistics on the prevalence and outcomes of breast cancer. So for at least a decade now, the percentage of women newly diagnosed with breast cancer has stayed about the same. It's been approximately 1 in 8 women in the United States who receive a new diagnosis each year. But we know that there are improved treatments, there is earlier detection, and the survival rate has improved immensely. So we want to find out more about it and learn what are some of these improvements and what we really need to know to protect ourselves from breast cancer and survive it as best possible. And I am so happy to welcome one of our partners for National Pink Day, which we'll be celebrating with the Women's Breast and Heart Initiative on Saturday the 23rd at Pembroke Lakes Mall. From Memorial Health System, Dr. Erica Bloomquist, and you are a breast cancer oncologist.
I am.
What exactly does that mean for someone who's never had to see an oncologist?
Thank goodness, right?
Yes.
So I'm a breast surgical oncologist to differentiate from breast medical oncology. So my role is to usually meet the women at the time of their diagnosis, do the complete workup, and then ultimately whatever surgical procedures they need in terms of their breast, the lymph nodes under their arm. That's what I do. And then I collaborate with my medical oncology colleagues to talk about other things, chemotherapy, endocrine therapy, etc.
Okay, and I want to ask you more about that in a couple of minutes, but I just want to start at the beginning because we talk about breast cancer so much, but I don't know how many of us, I certainly don't really know what exactly it is. I know there are cells, but I don't know why they can kill us in any kind of cancer.
So breast cancer is, like you said, all cancer starts with one cell that changes. We are in a very dynamic world and our body is, impacted by many different things. And something happens, it changes the DNA, the brains of one cell within the breast. And that change causes that cell to make many, many copies of itself.
Wow.
That's not what kills us. It's when those cells decide to leave the breast and travel somewhere else in the body, the lungs, the liver, the brain. Those areas can then become invaded with a tumor. So now they can't do their normal job anymore. And that's what it is that ultimately takes our life.
So it's when it metastasizes, when it spreads, that it can then start interfering with the processes.
Exactly right.
So if for some reason a tumor stayed in the breast, theoretically, you could just live with it.
So if it didn't have the ability to go anywhere else in the body and it just stayed in your breast, over time, though, it would continue to grow and grow until it causes a breakdown of your skin, a wound problem. And we do see, sadly, we see several women every month that come in with a neglected breast cancer.
Oh, my goodness.
That becomes another issue in terms of self-care and day-to-day living.
Let's talk a little bit about treatments. Is surgery always required when you find a tumor?
Although we are working towards doing less and less surgery, for now, surgery is still part of the treatment of breast cancer, even if they get chemotherapy or radiation or endocrine therapy.
Aren't there different levels? Like there's the lumpectomy and then there's a full mastectomy, and then there's a double mastectomy. Some people do it in advance, even if one breast isn't affected, to be sure. So what are the circumstances that would create different needs for different types of surgery?
Sure. So if you have a small tumor in your breast, and most women, we counsel them for a lumpectomy. We just remove the tumor itself with a small rim of normal breast tissue. Some women have tumors that are very large, and they could not undergo a lumpectomy without a severe cosmetic deformity to their breast. There are some that have breast cancer in 2 different quadrants of the breast where you can't successfully do a lumpectomy. So those are reasons from my standpoint to offer a mastectomy versus lumpectomy. But some women are just anxious. They're young.
Right.
They have children. They're working. And now they've got this diagnosis. And as women, we put ourselves last. We put our kids first, our husbands first, our jobs first, our dogs first. And they don't have time for anything. So they say, just take them both off. I don't care. I just want to be done with this. I don't want to think about it anymore.
Wow.
So a lot of women now are looking at it from a personal perspective. Because if you're a candidate for lumpectomy, whether you do lumpectomy and radiation or mastectomy, your survival is the same. And like you said, with our wonderful therapies that we have now, the recurrence in the breast after a lumpectomy with radiation is the same as mastectomy. So we kind of take that whole cancer thing out of the equation, and now it's just, what does a woman want? And I want to advocate for them.
We have talked throughout the month about what are the causes of breast cancer and the importance, of course, of getting mammograms. And that's one of the things that we're excited about with National Pink Day will be the opportunity to sign up for a low or no cost mammogram on that day. And Memorial will, of course, be with us at Pembroke Lakes Mall. What are some of the things that might indicate to someone that they need to be checked aside from the annual mammogram? Is there something physical that you can see or something you can feel? Or is there a way that you feel physically overall?
For early stage breast cancer, which we're trying to identify with screening, there shouldn't be kind of an overall feeling, but certainly any kind of lump or even thickening of your breast tissue. It doesn't have to be a lump, but just something to you that feels different. There's some kinds of cancers that maybe cause a thickening rather than a tumor ball. And so anything that feels different, if you have redness of your breast, if you have discharge coming from your nipple when you're not squeezing it, so spontaneous discharge, maybe even just a really focal area of breast pain that's brand new, like not the type that you get with your menstrual cycle every month with the achiness, but a pinpoint area.
Okay.
Although breast pain and cancer don't really go together, they might alert you to something's happening and draw those women into screening, and maybe we'll find some things somewhere else, but it's at least an opportunity to look sooner.
And the procedure, if you were to notice something is different, is you go to your primary care doctor, who can then refer you as necessary to a specialist or to get an interim screening, an interim mammogram?
Yeah, so if you do identify some finding or you're symptomatic in some way, then you would want to be referred for diagnostic breast imaging because we're researching a finding. Whereas women that feel fine, no issues, it's our annual screening. But you would want to go for diagnostic breast imaging if you feel something in between your screenings.
Okay. And of course, Memorial Health, you have an entire unit where you deal with this. What is the procedure for women who come to Memorial, and how do you work with them just to comfort them about getting a mammogram and about being told that they have a diagnosis and having to go through treatment?
So I'm very proud of our breast cancer center. I think we offer an amazing team that really cares about women and understands how traumatic it is to receive that diagnosis. And so when a woman calls Memorial, there's a call center number and they're immediately routed to our new patient coordinator who will help get all their information, such as collecting outside breast imaging and reports, collecting outside pathology reports, so the women don't have to do that.
Right.
And then we set up for them to see myself, our women's imagers, the same day. They meet our nurse navigator that will help them, they and their family sort of navigate the system because it's scary and you've got a lot of appointments.
Yeah, and I've got to imagine your head is just a whirlwind when you hear that diagnosis. You can't probably focus on the details and keeping track of dates and that sort of thing.
Exactly right. And so I tell women, don't worry, we've got you. We're here. We've got a whole team that's going to take care of you and your family. Just, give yourself over to us. We'll tell you where to be and when, and just go.
Wow.
Because I think it takes such a load off because, like I said, they are thinking about their job. How am I going to have breast cancer while I'm working? How am I going to have breast cancer when I'm a mom? What do I tell my children? I mean, there's so many things that come into it that have really nothing to do with her own health. It's just,
right.
What do I do with everybody else?
And yet people actually can do those things now because even chemotherapies are easier to tolerate, and you have medications to offset some of the side effects.
Correct. It's amazing how far we've come and what we can offer to prevent all of the symptoms that women fear from chemotherapy and make it much easier. And a lot of our ladies, they keep working, they keep taking care of their children, they keep exercising, they keep living their life. It's really fantastic for them.
I want to bring in Andrea Ivory, who is the founder of the Women's Breast and Heart Initiative, and who came to us with the whole concept of making something out of National Pink Day, because before this, it was always October Breast Cancer Awareness Month, and then 11 months go by, and suddenly everyone's talking about breast cancer again. And in the meantime, thousands of people are being diagnosed. So it's something we need to be aware of all the time. Andrea, you are a breast cancer survivor. Our audience must know that by now. And you took your experience and turned it into this amazing organization where you literally go door to door in underserved neighborhoods to offer free mammograms to women.
Well, thank you so very much for having us here today, Ellen. It's always a pleasure to come back and always a pleasure to share about the importance of prevention and early detection.
By offering these women free mammograms, you've undoubtedly saved lives.
Yes. As we go door to door, we like to think of a more comprehensive approach, because what we do is we provide resources for at-risk women to understand their risks, and not only understand their risk, what they can do to mitigate the damage, what they can do to reduce their risks. And then while we're there, we make an appointment for them to receive a mammogram at no cost to them. And it's because of partners like Memorial that we're able to do this, because they provide us reduced fees. You know, the services are not free to us, they're free to the women. So we are so grateful that we have amazing partners. And let me just say that Memorial was our first partner.
Wow. Bravo.
When we had the vision, we made the call. We thought they were going to say, you people are crazy, but they didn't. They said, you know what? That's a unique concept and approach, and we're on board. So we've been partners with Memorial for more than 13 years, and the relationship has grown. So they're definitely proactive and want to ensure that the community has the benefit of prevention and early detection, and we're proud to partner with them.
Now, you mentioned it's not free to you as an organization, so you do fundraisers. You have a major gala that happened just a couple months ago, and one of the opportunities that will be available on National Pink Day is that people can make a $10 donation to the Women's Breast and Heart Initiative, and for that they'll receive a fabulous pink I Can t-shirt, and all that money goes to help support this, reaching more than 100,000 people so far.
So we're really excited that we have the opportunity to reach the population that needs us most door to door, but we don't want to forget everyone, because all women are at risk. And there are all kinds of barriers. There are structural barriers. There, people have to work. So there are things that prohibit women from taking advantage of preventive measures. So this event, National Pink Day, I Can, the ways that you can say I can is show up. Just come to Pembroke Lakes Mall on the 23rd and visit Memorial's table or any of the other tables and get information. We talked about pinky promises, making a pinky promise.
Yes. I have you to thank for that.
Yeah, Ellen and I made pinky promises because she was a little busy. She's one of the women that we target that are just too busy to get screened. So we made a pinky promise, and I called her, and she finally went and had her mammogram. And so we want to provide that same opportunity for all women at the mall. When they're walking by, maybe they are too busy and they don't have time to call. Well, we at the Women's Breast and Heart Initiative will be right there at the table, and we will take down their information and we'll make the appointment for them. We provide care coordination and navigation, as well as making sure that they can get the mammogram. So we're very excited about this because, as you mentioned, we put all of this focus about breast cancer prevention in October. We paint the town pink. We have pink cars, pink billboards. What about the rest of the year? So here was this great holiday, National Pink Day, and we decided, you know what? Let's make it count.
Yeah.
So let's band together with our collaborating partners that we do all the time, and let's move it. And I want to thank you, Ellen, for saying, why not? Let's have an event at the mall where people are shopping anyway. So thank you for the collaboration.
I am so excited. This has turned into a major event with prizes you cannot even imagine. So you come out wearing something pink. We take your picture for social media, and that will automatically give you a raffle ticket, which will qualify you for the grand prize for the day, $500 in Pandora jewelry from the Pandora Jewelry Store at Pembroke Lakes Mall. Then with your donation to the Women's Breast and Heart Initiative, you're going to get another raffle ticket. That's going to qualify you for, there's a $400 women's fragrance basket from Macy's. There is a pink Coach purse valued at close to $400 donated by Dillard's. And then there's the pink pass that you'll take around to meet everyone who's coming out to provide information and entertainment at our National Pink Day event. You get your pink pass stamped, and that makes you eligible for even more fantastic prizes donated by retailers at Pembroke Lakes Mall, and we have some goodies that we're bringing from Easy 93.1. But wait, there's more. California Pizza Kitchen is doing their Pizza with a Purpose Day. They will donate 20% of all sales for the day to the Women's Breast and Heart Initiative to help fund these mammograms that you make available. We will also have a mom and daughter Pinktastic fashion show put on by Macy's. Our friends at the Miami Cancer Institute from Baptist Health South Florida are presenting a Zumba demonstration. Memorial Health and the Memorial Cancer Institute will be teaching us about healthy snacks. Yes.
In addition, if in fact it's not in your area and you still want to participate in summer breast cancer awareness, it's simple as 1, 2, 3. Wear something pink. Take your pink self-wearing picture and post it on our Facebook page at the WBHI and at Easy931, and you can make a difference. The Miami Freedom Tower will be lit pink to honor summer breast cancer awareness. The Miami Heat is participating. On the outside of the arena, they're going to have messages about National Pink Day and summer breast cancer awareness. So it grows every year, and we hope that it's another opportunity to create another October type of event.
Absolutely.
The more awareness, the more prevention, the more early detection, the more lives saved.
Okay. Your website for anyone who wants information about Women's Breast and Heart Initiative
is FL, like the great state of Florida, breast, BREAST, health, HEALTH.com.
And the Memorial Health System website and how to arrange a mammogram.
So for the Memorial Cancer Institute specifically, it's Memorial Cancer Institute, all one word, .com. And on that website, you just click on breast and it will show you anything and everything related to getting in contact with us and all of the folks that are part of our team.
Is there a phone number?
Yes. So if women want to schedule their mammograms or ultrasounds, they get their prescription from their primary care physician or gynecologist, and then they can call 954-276-5595.
Okay, well, I can't tell you how much I appreciate you, Dr. Bloomquist, Erica Bloomquist, breast surgical oncologist at Memorial Health System, Memorial Cancer Institute, for taking time out of your day to talk to us and for Memorial being part of National Pink Day for the community.
Well, thank you so much for having me. This has been so much fun, and I've enjoyed visiting with all of you ladies. Thank you.
And, of course, the audience can meet you, Dr. Bloomquist, next Saturday, 6 days away, June 23rd, for National Pink Day. We will all be together at Pembroke Lakes Mall from noon to 3, and you can find all the details on our Facebook events page. Search Easy931. I'm Ellen Jaffe. Thank you for listening to Easy's Community Focus. If you have questions or would like to suggest a topic, please email me at ellen@easy93.com. Have a great day.